Hi, my name is Noreen and I am the TPN nurse specialist. Today I'm going to demonstrate how to connect and disconnect TPN aseptically. As you know, TPN is given to some of our sickest patients and therefore it is important that we maintain sterility to avoid any bloodstream infection. Before you can connect or disconnect TPN, you must have completed your IV study day, the aseptic non-touch technique, standard precautions, and be deemed competent in the administration of IV medications. The key to maintaining a sterile technique is to be well prepared and have all the essential equipment gathered. So let's start by having a look at the equipment you will need. You will need the TPN bag that has been out of the fridge for 1 hour, a clean trolley, a dressing pack, sterile gloves, IV giving set, Clinell wipes, 10ml syringe, 10ml of saline, red cap, TPN labels, sterile gauze and alcohol hand gel. So now the bag is removed from the fridge 1 hour. So now we're going to check the regimen against the prescription so that we have the right date, the right regimen, the right MRN number and the right patient's name and expiry date against the prescription, the right patient, the right MRN, the regimen and the date for use on. Hang the bag of TPN from the drip stand and roll up the outer cover. Perform hand hygiene and begin to set up your trolley. When your trolley is set up, pour the saline into the sterile tray. Next, perform hand hygiene using soap and water or alcohol hand gel. Don your sterile gloves and draw up the saline. So we must close the roller clamp and remove the cap from the spike of the set. Get your alcohol wipe and sterile gauze and go to the end of the bag to clean the nozzle where the infuser mat set goes in. Cleaning the end of the infusion port, and as you're cleaning it, lick off the cap. Using a piece of sterile gauze, spike the giving set into the bag. Fill the drip chamber halfway. Turn on the roller clamp and prime the giving set, ensuring all air is removed from the line. Turn off the roller clamp and clip the line to the set. Next, place the sterile drape to the side of the line. Using a forceps, pick up the line. Holding the line with one alcohol wipe and with a second wipe, scrub the hub vigorously for 15 seconds. When you finish scrubbing the hub, place the line on the sterile drape. Pick up your syringe of saline and attach it to the line. Then unclamp the line. Draw back on the syringe to ensure you see a flash of blood, and using the push-pause technique, flush the line. To prevent air entering the line, the clamp should be closed while you are still pushing the syringe. Be careful, however, that the syringe does not disconnect and splash. Scrub the hub again for at least 15 seconds. Then connect the TPN and unclamp the central line. Wrap the gauze around the line and label it using the TPN labels. Dispose of all waste, remove your gloves and perform hand hygiene. Open the pump. Insert the infusomat set. Close the pump. Open the roller clamp. Set the rate and volume to be infused. And finally, press start. To disconnect the TPN, start by performing hand hygiene and donning a pair of clean gloves. Stop the infusion, close the roller clamp and eject the giving set from the pump. Then turn off the pump. Next, clamp the central line and remove the gauze covering. If you are recommencing TPN, then set a dressing trolley up as before. If you're disconnecting or discontinuing TPN, then set the dressing trolley up as before, but without the infusomat giving set. You will, however, need a green Curos protective cover. Once the trolley is set up, perform hand hygiene, don the sterile gloves and place the dressing drape beside the line. Pick up the line using a forceps and with 2 alcohol wipes clean around the connection and disconnect the giving set. Then scrub the hub for 15 seconds. Attach the 10 ml of saline, undo the clamp and using the push-pause technique, flush the line. Towards the end of the flush, close the clamp while still pushing the syringe. Scrub the hub once again and apply the Curos green protective cap. Finally, dispose of all waste and sharps as per hospital policy. Ensure your patient is comfortable. Perform hand hygiene and document in the fluid balance and the nursing care plan. I hope you found this video useful today. Remember, there is more information available on bars and you can review the hospital policy at any time on QPulse. Of course, if you have any questions, you can contact me on Bleep 274. Thank you.